what's changed since then is a lot of our ability to know where we're going, to know what we're doing, and we have some successes. Specifically, successes with deep brain stimulation for motion disorders, particularly Parkinson's disease. The FDA has approved deep brain stimulation for Parkinson's disease. It approved it in 1997. And a number of other motion disorders have followed. With deep brain stimulation, an electrode in the brain, put in a particular region with usually some period of tuning in terms of the voltage, the amperage, the frequency, and so on, has been shown to relieve symptoms of a number of these diseases and has been used in other brain regions for other diseases. So, for example, Helen Mayberg and others have been doing really interesting work using deep brain stimulation as a treatment for refractory depression. For people whose depression did not resolve with any other treatment. She's had some small n, but some startling successes, and it's now subject of a larger trial. People have been using with, again, some reported successes, deep brain stimulation for obsessive-compulsive disorder. People have also been using it for smoking cessation, or weight loss, or gambling addiction, or a whole bunch of things for which there's not a particularly good either evidence-based or plausible story about why it should work. But one of the amazing things about deep brain stimulation, apart from the fact that even with Parkinson's, where it's been used for over a decade, where it's been approved for over a decade, we're still not sure how it works. The other thing is you see odd results sometimes. So I mentioned weight loss. There was a study published 2 years ago coming out of the University of Toronto. A guy who was morbidly obese, 500, 600 pounds, desperately needed to lose weight, and was unwilling to have the safe and effective stomach stapling or stomach banding surgeries, but was willing to have an electrode stuck in his head for weight loss. This, to me, raises flags about competency, but maybe that's just my taste. So they did it. They put it in his hypothalamus, region of his hypothalamus, turned it on, and it took some adjustments, some playing around. Ultimately, it worked. He lost his appetite to gorge. He lost about 20 pounds in a month. But then more ultimately, if I can say that, it didn't work because he got bored that way, turned it off, and gained all the weight back in 3 weeks. But while the electrode was turned on, he showed signs of remarkable memory, both in terms of his ability to remember things now and his apparent near total recall of events in the past, of dates he had been on. It was as if he was reliving it, kind of the Penn experiments all over again. And of course, we don't really know whether those are memories or whether those are hallucinations. Nobody kept close records of a date he went on when he was 18 to see whether it was the same thing or not. But it was remarkable. And so in the story, in the article announcing this finding, the group ended by saying we are now recruiting patients for Alzheimer's, for studies of dementia. Nobody had any particular reason to think the electrode in this location would do anything with respect to memory, but it did. So deep brain stimulation is a really interesting modality. It's safe and effective enough for some uses to be clinically approved. But there's a lot of uncertainty about what's going to happen either with any one patient or with any one area. There is research going on the use of deep brain stimulation to treat aggressive behavior. An Italian group headed by Professor Francini has published several articles using deep brain stimulation, they report with success, to treat intractable aggressive behavior by developmentally limited adolescent men, or two boys, two brothers who had serious problem, and they report that when they turn this on, they become tractable. And they are continuing their research along that line. Third area, vaccines. It's a little more specialized, a little different. And I don't think anybody, as far as I know, although I'd be happy to be, well, not happy, I'd be interested to be corrected. As far as I know, nobody is working on a vaccine against aggressive behavior. But people are working on vaccines against certain drugs of abuse. The most interesting of which, I think, is the anti-cocaine vaccines, several of which are in phase 2, I think 2 of which are in phase 2 or phase 3 trials. The The one I know about best is a really clever idea. Cocaine's a little molecule. You get a antibody that sticks to it and clings to it, and the complex is too big to go through the blood-brain barrier. So you've got all this cocaine in your system, but none of it's getting to your brain. It may be doing other things in other parts of your body, but if it doesn't get to your brain, you don't get high. Now, right now, this is a relatively short-acting antibody. You need to be revaccinated fairly frequently, and it hasn't yet been proven safe and effective. But one can imagine a criminal judge, a judge in a criminal case, saying to somebody convicted of use of cocaine, okay, you've got a choice, 3 years in prison, or you take this vaccine over and over. So vaccinations for at least to block the effects of illicit drugs are another real possibility for an intervention, a brain-based intervention, well, immune system-based, but with its effects on the brain. It's intervention to stop behaviors we don't like. Fourth category, drugs. These, of course, have been used in various ways for a long time. Drugs against addiction, whether it's opiate addiction or whether it's alcohol addiction. Drugs for treatment of psychosis, long history of and long struggles and debates about mandatory treatment with antipsychotic drugs and so on. But as more and more drugs become available and we learn more about brain functioning, it opens the possibility of drugs aimed at particular kinds of criminal behavior. And this one is not hypothetical. It's the least hypothetical of the ones I want to tell you about. There is a drug which the laws of 7 states require be given to certain convicts on a long-term basis in an effort to cure them of their offensive behavior. The drug is known as Depo-Provera. Some of you may recognize it as a long-acting contraceptive. It is FDA approved based on studies of safety and efficacy in women for contraception. But it's used off-label in 7 states for sex offenders. Now, the states differ on how many offenses and what kind of offenses. And for 6 of them, it's mandatory, and for 1, the judge can order it discretionarily or not. But for many people, including my home state of California, this is a legal requirement. You're convicted of these offenses, you go on this drug, as a way of trying to stop your antisocial behavior. So, what I hope I've shown is there are a number of modalities out there, possible interventions, that might be used in ways to try to treat crime or other antisocial behaviors we don't like. I'm sure I've missed many of them, and in the examples I've given you and the categories I've given you, there are other examples I could use. But I now want to move to the second question, which I think is more important and more interesting. What about safety and efficacy? It's fine for the legislature of the state of California, in its world-renowned wisdom, to decide, yes, all sex offenders have to get Depo-Provera. But what does that mean about safety and efficacy? What does it have to mean? And the answer, unfortunately, is almost nothing. So look at the 4 kinds of interventions I talked about. Surgery. The FDA doesn't pass on surgery. The FDA regulates drugs and devices, and biologics, dietary supplements, and so on. It doesn't regulate surgeries. A surgeon can do anything he or she wants, as long as it doesn't involve new medical devices, without having to be FDA approved, without having to convince anybody that it's safe and effective, except maybe, if they're careful, the risk management committee at his hospital. I actually think hospital privileges may be the choke point here. He may have to convince, in regular medicine, insurance companies that this is cost-effective. But if you're dealing in a criminal setting, the insurance companies aren't going to have that kind of bottleneck checking role. So you could decide we're going to remove, I don't know, the entire left hypothalamus to treat jaywalking. And as long as your hospital privileges committee doesn't get wind of it or doesn't balk at it, there's no legal barrier to it. There may be legal consequences in terms of malpractice, or most likely there won't be.